So Dr. Loghavi is going to be presenting our abstract on blast enumeration in NPM1-mutated myeloid neoplasms, really not acute myeloid leukemia. On behalf of our colleagues, this was a project that was done in collaboration with Dr. Papa-Manuel's lab, Ellie Papa-Manuel at MSK Cancer Center, and also Dr. Elsa Bernard was a really fantastic collaborator with us on this project. And really it goes back to the relevance of blast enumeration in NPM1-mutated myeloid neoplasms. The reason this is important is the classification of acute myeloid leukemias recently changed in that in the WHO classification, patients that have an NPM1 mutation and 5% or more blasts are considered to have acute myeloid leukemia. And then in the ICC classification, those with 10% or more blasts are considered to have acute myeloid leukemia. So we wanted to look at these, not necessarily compare the two classifications, but just look at the relevance of NPM1 mutation in what you would call chronic myeloid neoplasms, those that have less than 20% blasts. And really the most important points in their study, based on a large number of patients that were examined, is one, that really blast enumeration in the presence of NPM1 mutation is really not that relevant. And so patients that have lower blast counts, and we even looked at patients that have less than 5% blast counts, their disease tends to behave like those that have more than 20% blasts. So really it's the NPM1 mutation that is the acute leukemia defining alteration and really not the blast count. The second is that we looked at the prognostic relevance of myelodysplasia-related mutations in the setting of NPM1 mutated acute myeloid leukemia. And the reason this is important is because myelodysplasia-related mutations are considered adverse risk mutations in the ELN classification, in the 2022 iteration of ELN, unless they occur with favorable risk acute myeloid leukemia, of which NPM1 is considered to be favorable risk. So the point there was that we learned that patients with NPM1 mutated AML with co-occurrence of myelodysplasia-related mutations actually do have a worse outcome compared to those that don't have the myelodysplasia-related mutations. And this is more profoundly observed in patients that are younger. So really the difference was driven by patients that were less than 60 years of age. And the reason we think is that this is important is that the younger patients are the ones that are probably more likely to get considered for a stem cell transplant, and having favorable risk disease versus having intermediate or adverse risk disease really may influence that decision, whether or not to transplant the patients.